So probably for the last 2 years, myself and my company have been working a lot in AF and stroke prevention, very passionate about this, done lots and lots of educational meetings. And when you look at the data, there is a huge amount of work to do in anticoagulation. So what I'm going to just do, I'm just going to recap, and I appreciate some of you here are from secondary care, but I think it's a good insight for you to understand the targets in primary care. So I'm going to go through the QOF indicators for AF 2013 and 14, because that's where I'm going to present some of the data. Because if we look at QOF, it looks and appears that we've done our job with AF. Okay, but when we actually get to actual intervention, it's a completely different story. And there's a huge number of patients out there that are still at risk of stroke. So I'm going to show you that. I've also got some real world data to share. And then I sort of looked at the best and worst performing CCGs in terms of anticoagulation. And then I've got a couple of slides on the new NICE AF guidelines, and also what's going to happen now with AF QOF going forward in April. And I think those of you who are sat there and you've ticked those boxes, you'll see that your thresholds and achievement is just going to plummet because it's completely changing. So the message is, get ahead, start anticoagulating now. And then I'm just going to finish. We've put some resources together for Bayer Healthcare, for CCGs and practices, and you're all welcome to request those after the session. Okay, so just to start with, this is where we are currently at with the QOF indicators for QOF. So first of all, practices get 5 points for producing a register. It actually says that you have to maintain a register, not just produce one. And I'll tell you what that means later on in my presentation, because I know I've looked at the data nationally. There's huge variances in terms of prevalence. That varies depending on what you're doing, how proactive you are at picking up AF patients, and also your data quality. So it's recognised that registers aren't accurate. But it's down to you as a contractor to maintain the accuracy of the register.